8:07 is the time right now. Still ahead here on Good Morning Arizona. They're supposed to make us feel better, but are we taking too many antibiotics? We're talking to Dr. Sharon Thompson about how they're prescribed and why they're starting to become resistant. It's also that time of the year when everyone seems to get sick. A cold, is it the flu? And your first thought may be, well, I should go see a doctor, get some antibiotics to nip this in the butt, but that may not always be the best route to go. So joining us this morning to talk about some of the problems with antibiotics is Dr. Sharon Thompson. She's with Central Phoenix Obstetrics and Gynecology. Good morning.
Good morning.
You know, we hear about this, the overuse of antibiotics.
Unfortunately, it's becoming a real problem. Antibiotics are wonderful, and they really are a marvel of modern medicine that save lots of lives, but we tend to reflex to them a little bit too much. This is a time of year where everybody's sniffly, your throat is scratchy, your ears are stuffed up, and that's usually viruses.
Okay.
And antibiotics only treat bacterial infections. They do not treat viruses. So they don't help you at all if a virus is the cause of your problem.
What are some of the bad effects of overusing antibiotics?
The major one that we worry about the most is that if we give our bodies antibiotics when in fact bacteria is not an issue, we could destroy the good bacteria. We have lots of bacteria in our bodies that actually help keep us healthy, and when we kill those, then we are prone to infections from what's left over. So that's one major problem. The second one is that bacteria are very good at evolving. And so you expose them to a drug, some of the bacteria die, but some don't, and those will become resistant. Now you're unable to use that antibiotic to kill that bacteria. That's becoming a huge problem in medicine for lots of bacteria, lots of infections.
I've heard about that, the overdosing and that such. So when do you know if it is time to go see a doctor or when it is the common cold? Because it's very similar symptoms.
Absolutely. Common colds tend to last about 7 to 10 days.
Okay.
So if you're sick beyond 10 days, time to maybe talk to your doctor about what might be happening for you. If you're having high fevers for more than 2 days or so, and by high I mean over 101.
I was going to say, what's considered high?
And this all applies to adults who were otherwise in good health.
Okay.
Because children, different story altogether, so call your pediatrician. Or if you have chronic health diseases, this doesn't apply to you. So high fever, your illness lasts longer. If you're having severe pain of any kind, if you can't breathe, I always say breathing is never optional.
No, if you're having problems, that's when you should go.
All the time, exactly. Or severe pain that makes you feel like, God, I need some strong pain medicine for this. Over-the-counter medicines aren't working. Then consult your doctor and see if you may need antibiotics.
Okay, very good. And you know, you do need to see a doctor when it's been that long, right?
Absolutely.
We talk about when it's time to go, but what can you do at home when you're in that 7 to 8 period, you're thinking maybe it is just a cold? What can we do at home?
First thing is whine and complain. You're not feeling
well. We've got that down.
Get to whine and complain. But lots and lots of fluids. Okay. Definitely make sure your appetite may not be there, but stick to the fluids as long as you're well hydrated. I'm a big vitamin C fan, so I always treat colds with lots and lots of vitamin C. And the vitamin C lozenges are great for a sore throat. Gargling with salt and water helps, and it helps early on when you feel those first signs, because it may prevent that virus from lodging in those cells in your throat.
So there's something true to what your mom says.
Yeah, listen to your mom. Humidify the air in your room. That helps with congestion, where you're feeling stuffy, your nose gets so dry. And of course, the Tylenol and ibuprofen, used as directed, can help with those body aches that you can get.
Okay, that is fantastic. Great tips as always.
Definitely.
Before we go, I have one quick question. We've heard in the news how much we've seen the flu this year compared to other years. Is that an indication of anything?
First of all, get your flu shot. Flu shots are safe and effective, especially if you have a chronic disease or are pregnant. Those are populations that the flu vaccine can be very, very protective. So get your flu shot. And, you know, the flu is a different virus from the ones that give us the common cold. Common colds are so common this time of year. And the flu, we'll see how the season goes. You always kind of have to see every season how the flu goes, but get vaccinated.
All right. It's definitely not too late.
It is not too late. It is just the beginning.
Thank you, Dr. Thompson. We always appreciate your great advice.
Thanks for having me.